following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Harrison's abdominal pain, Angela's basketball injury, Travis's corneal transplant, and Renee struggles with cerebral palsy.
It's a nervous situation right now. We know in all simple operations there can be complications, so you still have that in the back of your mind.
Seven-year-old Renee has cerebral palsy, a disorder that causes her muscles to become tight and rigid. The muscles of Renee's digestive system do not work well, and she is struggling with reflux or chronic vomiting, making it difficult for her to meet her nutritional requirements and gain weight.
So I'm just going to have a listen to your heart. It's going to be a little chilly.
Today, Renee will undergo surgery to repair her intestinal tract.
Your feet, they're cold. Good breathing. Okay, very good. Okay, we have porters that are going to pick you guys up and take you downstairs to the waiting area on the second floor. Okay. And you'll see Dr. Langer and the anesthetist down there. Okay? Okay? Good.
Yes, okay, sweetheart. Usually on mornings, because she goes to school, and if she spits up, it's the start of a bad day for her. So if we can eliminate that in her morning process, we think she'll be a lot more comfortable at school. What Dr. Langer explained to us is the muscle around the esophagus is not as tight as it should be. So you get, when she sleeps at night, you get things from the stomach coming back into the esophagus. So what he wanted to do is to tighten around the esophagus where that muscle is supposed to be.
It's the first surgery that she will be having. So I'm nervous as a mom. I hope that, trust that and pray that everything will go well today.
We know in all simple operations there can be complications, so you still have that in the back of your mind. But we hope everything will go well, and with this surgery, hoping that she will have a better quality of life at this.
Renee will be taken for her surgery in just a few minutes. Seven-year-old Harrison has been suffering from abdominal pain for the last 24 hours. His family doctor suspects appendicitis and has sent him to the emergency room at the Hospital for Sick Children.
Harrison had come home yesterday from school with a tummy ache, and he had a fever, etc. And then this morning, he came down the stairs and he could barely walk, and was crying and feverish, and
it hurts like somebody is throwing sticks at me.
Okay. And what we need to do is take a little bit of blood from you and put in a little tiny IV, okay? So it's a needle, and it's going to be one poke, and we'll take the blood and do the IV from that. And then after that, no more ouchies, okay? That's the only one.
Are you okay on your back, or are you more comfy like that?
I'm more comfy like that.
Okay. Are you going to be able to lie still that way? Or do you want to put this hand back there and maybe squeeze somebody's hand? There we go.
Squeeze my hand.
Excellent. Okay, there's going to be a little ouchie on 3. Ready?
And
1, 2, 3.
No, lie still. You're okay.
Good job.
You're okay.
You're doing excellent.
You got to keep telling her about school.
And talk about Mrs. Cliff.
Ouchie's all done.
He's okay. Do you want to come talk to him?
he's okay.
Come on up here and talk to your brother, sweetie.
Hey. Rachel, I'm okay.
Rachel, do you hear
He's
your
talking
brother?
to you.
Tell her again.
Did you hear him?
Rachel, I'm okay.
What do you think? I'll take a look.
You okay now, Rachel?
Maybe we can get a Teeter or Nintendo in here for you. Do you like that stuff?
Uh-huh.
Yeah?
All right, we'll see you in a bit. We'll get you TV, okay?
Renee's parents take her to the OR waiting room for a meeting with her surgeon.
Hello, Renee. How are you? Are you all set for your operation?
Are you?
Not sure, huh? I took another look at her x-rays, and it does show the reflux where the stomach contents are going back up as she eats. She also has a hiatal hernia, which means that the hole in the diaphragm that the esophagus goes through is a little bigger than normal, and the top part of her stomach is kind of sliding up through the diaphragm and into her chest a little bit. And having a hiatal hernia is often associated with having the reflux, so the two things often go together. So the operation that we're going to do, the fundoplication, which creates a valve that prevents the stomach contents from going back up, we'll also have to close up that hole in the diaphragm a little bit so that the stomach can't slip back up, which makes the operation a little more complex and a little more difficult, and increases a little bit the possibility that we may have to make a regular incision rather than doing it laparoscopically. The problem is, because of her CP, the muscles of her entire intestinal tract don't work normally. And it's very common in these kids for them to have the reflux. All right, any questions?
No.
Thank you. We'll see you later.
Thank you.
We'll see you soon, Renee. Okay.
The general surgery fellow on call for the emergency room checks Harrison's symptoms.
Hi, Dr. Valerie. Are you feeling sick to your stomach now or nauseous?
Not much.
What is it that's bothering you the most now?
My tongue right here.
Can you show me where it hurts the most? Okay. Okay. That does hurt though. How about at the belly button?
Oh.
That hurts as well? Okay. All right. I mean, he has some of the features of appendicitis in the fever, which he has here now.
Right.
The pain, and then the vomiting, and not really wanting to eat, at least initially, are all consistent with appendicitis. However, we're going to check the white blood cell count and see if it's high or not. And we're probably going to get an ultrasound to see if the appendix is inflamed.
Okay.
And then we'll go from there. Okay? So we'll get that set up.
Harrison is taken for his ultrasound.
Take a nice big breath in again for me, please, Harrison. Hold it all in, keep it all inside.
The ultrasound will help doctors determine if Harrison has appendicitis and whether he might need surgery.
Excellent.
The surgical team is ready for Renee.
See you later. After surgery. Okay?
Her mother accompanies her to the operating room.
So what I'm gonna do, Mom,
We can turn the room lights down, please.
Doctors hope to minimize the impact of surgery on Renee by using laparoscopic techniques to keep the incisions small. A miniature camera and tiny instruments are inserted into openings in her abdomen.
So we're going to try and do this laparoscopically. I think that we will probably have trouble, but I think it's worth a try. So we've put in all of our ports, all the small incisions that we put these instruments in the scope through. So now we're going to just repair the hiatal hernia. See right there, that's the hole in the diaphragm, and that's the esophagus coming through. And there's our stitches to close up that hole.
If doctors can complete repairs to Renee's intestinal tract without making a larger opening, they will spare her from a more painful recovery. Harrison's test results are ready.
Hi. So the white blood cell count is elevated, Right. so it's high. not terribly high, but high enough to make us suspicious. And the ultrasound was very suggestive of appendicitis.
Right.
So the entire story and the positive ultrasound also points towards appendicitis.
Yes.
So we're going to treat him as such. And what that means is an operation. And upstairs you'll get to meet Dr. Wales, who's the staff person involved.
Right.
Okay.
Thank you.
All right.
Great, thank you very much.
I would have hoped that he didn't have appendicitis, but I'm glad we got it caught and they're gonna be able to do something for him.
Renee's surgery has been underway for 2 hours.
So we're finished repairing the hiatal hernia, and now we're going to do the fundoplication.
A fundoplication is the procedure doctors will use to prevent the contents of Renee's stomach from coming back up.
So we've pulled part of the stomach around behind the esophagus, and we're going to now use some stitches to wrap the top of the stomach around the bottom of the esophagus. Yeah, and I think that's where you want to be, right there.
A valve is created by tightening the upper part of her stomach, called the fundus, around her esophagus.
Okay, so here goes our fundoplication. It is a very good wrap. Hi, we're all done. It went fine. We did it laparoscopically. It was a little bit tricky. You know, there were a few technical challenges, but we were able to do it safely, and I'm quite happy with the result. It looks very good.
Okay.
She will still have some pain, even though it's laparoscopic. They still have pain. It hurts where the cuts are, and it also hurts because we had gas in her belly for 4 or 5 hours.
Right.
So we'll give her morphine for that. She'll probably need that for a few days.
Okay.
All right.
Okay, thank you.
See you later. Okay.
Ready? Okay, don't cry, okay? Okay, just stay quiet. Okay? Hey? You want to get up? No, you can't get up now. Okay? Just stay there for a minute, okay? Okay? Repeat it 3. Don't cry.
Renee will remain in the recovery room until she is stable enough to move to the general surgery unit. Harrison is taken to the OR waiting room.
Basically, what we're dealing with here is the appendix. It's like a little finger, hangs off the side of the first part of your large bowel, and it doesn't really do anything except cause problems and bring you into the hospital. You know. What happens in appendicitis, this little finger gets blocked by either a piece of food or a piece of stool, or sometimes the little lymph nodes in that area swell up and block it. And we need to take it out to make him feel better. Right? And the way we do that is to do a little operation. Once he's asleep, we make a little incision in the skin right over where the appendix is. We find the appendix, and we take out the appendix and we put a couple little stitches in. Because it's a procedure, there's some potential complications, just like any operation. There's a risk of bleeding. There's a risk of infection, either inside the tummy where the appendix was, or in the skin incision. And that risk will vary depending on whether the appendix is burst or not burst. Okay?
Give everybody a kiss, Harrison.
Rich, you gonna come get me?
Bye, Dad.
Have fun, man.
Take it easy.
How about you over there? You want to say bye to Harrison?
Give Harrison a kiss.
Bye, Rachel. Rachel, it's not gonna hurt. It's not.
He's gonna sleep through the whole thing.
Yeah, so it's not gonna hurt.
Probably. Okay, Harrison, let's go.
Bye, honey bun.
See you in a little while, Harrison.
Bye-bye. So this is the operating room, Harrison. you're going to be up on that skinny little white table there.
No, that's fine. Well, appendicitis it's really common, and people kind of underestimate it. It can be incredibly serious. In fact, we had a recent patient not long ago who came in with a life-threatening infection. The other thing is that, it can sometimes be difficult to diagnose. So even though it's a common problem, it can be quite humbling too. So what Evans is trying to do is see if he can deliver the appendix out of the wound. We can see the cecum, which is the first part of the large bowel where the appendix is attached to.
Another background, please.
There it is. Hey, all right. Okay. You got that? Mm-hmm. Okay, so here's the appendix. You can see that it's all inflamed at the tip, and there's some exudate, as we call it. So what we need to do is free up the appendix down to the cecum before we can take it off. So this would be an acute appendicitis, but it's not, wouldn't call it perforated. Probably another 4 or 5 hours you'd be at risk of perforation. Like we'll tell you. You got it.
14-year-old Angela also finds herself in the emergency room. She has come to the hospital with her grandmother after being injured in a basketball game.
Around 12. Okay, look at this hand. Did you put any ice on it?
Yeah.
Okay. So this finger here, right?
Yeah.
Did all yet?
That one really hurts.
I haven't even touched it
I know,
yet.
I'm just saying that one is.
I'm going to do this one next. Is that okay?
Yeah.
Okay. Can you bend your fingers at all?
Not
Can you make a
really,
fist?
No.
Bend them down. Bend them down. Bend them down. All of them.
No.
Hurts too much?
Yeah.
Okay.
That one really.
Well, we definitely need an X-ray.
Okay.
So I'll get the paperwork ready for you and we'll send you off.
I also have this form that was going to us to fill out. Okay.
Be back in a minute, okay?
All right.
I was playing basketball and the ball hit me around there, and I guess I just caught it wrong. And then my hand started to turn blue because I had 2 rings on this finger, and we had to go to the jeweler's to get it cut off. I hope it's not broken because I can't write with my left hand, and I have a lot
to do this weekend.
Yeah, I want to go ice skating. I'm hoping my little cousins are coming down and they're going to take me up to their lake because their lake is frozen. They've got 5 inches of ice and I'm really hoping to go ice skating.
Harrison has been in surgery for 1 hour. Doctors are ready to remove his appendix.
So Evans is working his way down the base of towards the cecum. You can see we've divided the blood vessels up here, and it's freeing up the appendix. It's quite long in this Harrison. Okay, so you can see that now the appendix is starting to widen again. It came down narrow here, and now it's widening again. That means we're at the cecum where it attaches. So we're going to tie the base of it off here and cut it off and get rid of the appendix. There we go, there's the appendix. Okay, snaps please. And we'll take the 2-0.
Once doctors close, Harrison's appendectomy will be complete.
So we're all done.
Great.
He definitely had appendicitis and he definitely needed to have it out, but it wasn't ruptured. His pain will change from the kind of pain that he had before the operation from the appendix to a bit of, it'll be muscular pain from the incision. Over the next 24 to 48 hours as he tolerates more fluids and starts to eat and we get him off the morphine, then he can go home. All right?
Great.
Thank
you very much.
See you in the morning.
Thank
you.
Thanks.
Be good.
Yeah, I'm happy.
Oh, your baby boy.
I know, my baby boy, my only boy.
Angela is taken for x-rays of her injured hand.
Just come this way. Seat right there. Put it a little bit more in the middle like that. Good.
Can you separate that finger that's hurting and bring it out a little bit more? Or bring these ones in and maybe separate this one out? Can you do that at all? I don't want to pull on it because I don't want to hurt it. No? Okay, that's fine. As much as you can. Try to separate it as much as you can now. A little bit more. Okay, don't move. Good. Okay, that's it. So I'm going to have a look at these, but you can wait outside in our waiting room, okay?
The x-rays will be reviewed to determine if Angela has fractured a bone.
I'll be around 5 minutes to check these.
One day after surgery, Renee's cerebral palsy complicates her recovery. She has been unable to swallow the oral medication that keeps her muscles relaxed, and as a result, they are tighter and more painful than usual.
Hi, Mrs. Robinson. So I guess the issues this morning really is the spasticity that we discussed earlier. Did you have any other concerns this morning?
It's just the, the tightness. That's my concern, really. Because once she's like that, nothing really, you can get done to her. So, she wanted to clean her up and stuff, but she was that tight. She prefer leave her till, yeah.
One of the other things we can try doing is we can try giving the baclofen through the nasogastric tube.
Right.
If for some reason the neurologist doesn't have a good intravenous drug that we can use.
Right.
I'm not sure how much she'll absorb, but it certainly won't hurt anything. And if we can get some effect from the baclofen, that may help with the spasticity that she's having. Because it sounds like the amount that she's been on is quite a bit, and that she probably still needs it quite a bit.
Yeah. There's nothing happening, Renee. Renee. Relax a bit. There's nothing happening, okay? Okay?
I think she was just getting anxious because I'm hearing. We'll be by again later on this afternoon and see if we've made any headway with the spasticity, all right? Okay, we'll see you later.
It's been 1 day since Harrison's appendectomy.
When I walk, it hurts very much.
And they said the more you walk, the better you'll feel. I know you don't want to, but let's give it a try, okay? The more walking you do, the sooner we'll be out of here. Okay, can you stand up on your own? You got it. There you go. Okay. We'll do once around the nursing station. There you go. You're doing well. We'll have to keep going. We're almost there. We're almost there, and then we'll lie in bed together. I'll read your book. About 3 days from now, you'll be running and jumping just like normal.
Angela's x-ray results are ready.
So looking at the x-ray, I did not see any break. I know it's quite tender here for you. Okay. All right. And down here. What about down here?
Yeah.
Okay. And although you're tender over the area where the growth plate is, you actually seem to be more tender, in the middle, and there's no growth plate there. So at this point, I'd say nothing to be concerned about. My suggestion would be to ice it to help to bring the swelling down, and the pain will come down with icing it as the swelling goes down. Okay?
She doesn't need a splint or anything like that,
No.
just to protect it from any more.
Well, my suggestion would be, like I said, because I'm not concerned about any actual fracture here, would be that you definitely avoid playing basketball or any other sports.
Okay, how about skating on the weekend?
Sorry, how about?
As long as she doesn't fall, right?
Skating?
Yeah.
Yeah, the concern is that if you do fall and re-injuring it. You know, I think that if you're very careful, I'm not going to deny you of having a fun weekend, but just, no spins, no pirouettes. Okay?
Okay, that's great. Thank you very much.
All right, you're welcome. Take care.
No basketball.
It's kind of sad.
Although Angela's hand is painful, it should heal on its own, as long as she takes care not to re-injure it over the next week.
Call and get a ride home now.
It's a good look for him.
10-week-old Travis was born with congenital cloudy corneas. As a result, his eyes have a milky appearance, and his vision is seriously impaired.
You're just hungry.
Travis underwent surgery to transplant a cornea in his left eye just 4 weeks ago.
Mommy, would you rather have him in your arms or?
No.
Today, he will have surgery on his right eye.
They did his foot last time.
Thumb's perfect.
Thumb's good?
Thumb works for me.
Daddy, I'm worried about you. You okay?
I'm worried about me too.
Not the last one.
I haven't passed out in at least 3 hours. I should be okay.
Okay, let's just see what we can get here, buddy, eh? Sometimes these get messy. Ouchie boo.
Just bite real tight.
Buddy
Just
boy.
bite real tight.
It's a
Okay?
good boy.
Just bite real tight.
Just squeeze in, baby.
You're okay. Just bite it. Just bite it. Just bite it. You're okay.
You're doing a great job.
Okay, 2 more drops, boo-boo guy. You are fantastic.
You are doing such
Okay.
a good job.
Solid now. If everything was like that.
Daddy. It's a good thing the ladies have the children, eh? The babies.
Oh,
I don't know how you would do it.
I'd be childless. There's no doubt about it. No doubt about it.
Okay.
It's okay, buddy.
Travis is taken to the OR waiting room.
Yeah, I'm looking forward to everything being over with. And being able to see his eyes both look normal.
The first one went perfect, and I'm not really a pessimist, but we don't have any guarantees, so I'll be happy in about 6-7 hours when everything's done and everything works out as well as the first one.
Just hanging on for dear life.
It has been 3 days since Renee's surgery.
Friday night, I think, was the worst, and Saturday during the day, because she didn't have her baclofen at the time, she was very spastic, so. But after that, she calmed down a lot.
Hey, Renee. How are you feeling? Does it still hurt? A little bit? Yeah. Is it better than it was? A little bit? Better every day? Do you think she's better?
Yes.
Okay, so we'll slowly wean her off the morphine. That will also help to get her intestines working a little better, because the morphine tends to slow things down. And her intestines are a little slow to start with. So, just take a quick peek here. I'm not going to push on it, sweetie. I just want to look.
It's okay, sweetie. It's okay.
Yeah, that looks good. All right. Slowly but surely, a little better every day. See you later.
Okay.
Travis's surgery is minutes away.
Oh, big time.
So what sort of things have you noticed?
Oh, he just, he follows you around now with his eyes, and he's just starting to kind of smile and laugh at you, and just before he never used to look up at you when you're giving him his bottle and everything. Yeah.
The cornea that he had before, he wasn't able to see much through there at all. He was looking through milk glass, but
Yeah, I
now...
think he's a little frustrated with his other eye.
Well, we'll take care of that today. And try and sneak up on him.
Oh, it looks so clear. It looks so good.
Nice.
It looks marvelous.
Yeah, it looks great.
I'm very, very pleased. I'm really pleased so far, and we'll keep our fingers crossed for the other eye.
Absolutely.
All right?
Yeah.
Okay.
Thanks, Doc. Hi, little man. I'll see you in a bit.
He's hungry.
Bye, sweetie.
Okay, I know you're hungry. I know. Gonna take a good care.
I know. Thanks. See you, buddy. It's okay, sweetie.
Right, so we did the left eye last month. So now we're going to put a new window on the right eye. I've been fortunate to be able to make an impact already. Hopefully this will give him 2 eyes to see with instead of just one. Okay, can we get the microscope in, please?
And if we could get the donor when we get a chance. And I'd like, okay. Try and go perfect with this.
The team prepares to remove Travis's cloudy cornea.
Certainly this eardectomy children have eat.
I'm gonna turn you around. How do you feel? Okay? You gonna let me pick you up and put you in the chair, okay? You're not gonna get too nervous?
Before she can eat again, Renee's digestive system must be ready to work.
You're doing good. Thank you. Smile. Perfect. What's that? You're a ham.
Beginning to sit up will help her intestinal tract to recover.
I'm gonna smooth that. Baby. No, it isn't gonna work. You okay? Is it hurting? There we go. You gotta sit. Are you scared? Is it hurting you? No. Go back. You just relax. Just put a minute, Ren. Okay. It's not working. It's not usually so tight when you get in our chair, right? It's much easier. Yeah. It's just so tight, eh? There.
Renee's muscles are still too tight for her to sit in her chair. She will start by sitting with her mother.
Maybe later, eh? You're so tight.
2 days after his appendectomy, Harrison waits to be seen by his surgeon.
Hey, how are you?
Doing well.
See you again. You look fantastic. Look at you. So by the fact that the bed is taken down and the bags are packed, looks like you're trying to tell me something, eh? You want to go home? Okay. Do you mind if I sneak a peek? I know you're all dressed and everything, but I just want to sneak a peek. Looks really good.
Ow.
Okay. All right. So we'll let you go. You can do whatever you want. His body will kind of regulate itself. Right. He's got to have a little bit of discomfort there. All right. If the skin becomes red, or it starts to look a little bit pussy, or he gets belly pain, or nauseated, or a fever, then it may mean that there's an infection. So you call me, okay? Good luck there, big guy. Take it easy, okay? We'll see you in a month. All right, ciao. There's right here.
Harrison will return in 1 month to ensure he continues to heal well. Travis has been in surgery for 1 hour. His doctor is ready to transplant a donated cornea in his eye.
Can I have the donor now, please?
Once the cornea is sutured into place, the transplant will be complete.
Wait. Everything went just great, no problems at all. In the right eye, I think the eye was slightly larger, so the transplant is also slightly larger.
Okay.
And it went very well, no problems at all. The pupil is abnormal in shape in both eyes. They're both slightly underdeveloped.
Okay.
And I tried to round it up a little bit, just made a tiny little nick in the iris to make it more central so that it'll be easier for him to see and to give him glasses and that sort of thing. I'm very pleased.
Perfect.
So, yeah. All right? Okay.
Perfect. Okay.
Okay.
Thank
nice
you.
Hey, Borg Part 2.
Travis will be constantly monitored for signs of infection and rejection as his cornea transplant heals. if all goes well, his stitches can be removed in 1 month, and he will be one step closer to recovering his vision.
It's okay. It's okay.
1 week after surgery, Renee continues to grow stronger. Her muscles are more relaxed, and she is ready to resume eating.
Okay, sweetheart, I brought you some ice cream. Does she like pudding?
You eat that thing?
Do you eat pudding, sweetie? Vanilla pudding.
Yeah.
Yeah? Okay. You want to start with the ice cream? And see how you do? Do you feel hungry?
She wants donuts.
Oh, she wants donuts.
Yeah, but Dr. Langer said you can
Not
cut them.
quite
Yeah.
yet.
Yeah, he said you cut them in small pieces.
Really?
Okay.
Oh, that's a big step.
He said, give her small bits. Cool?
Yeah.
You cool? Okay. Tastes good? It cold, eh? But I saw you scream, cold. Gonna have some more? Huh? Just to put in now. Tastes good?
Thank you.
You're welcome, sweetheart. So just let me know how she does.
Yeah,
with
okay,
eating.
alrighty.
Okay.
Okay.
Bye.
Bye, sweetheart.
Can you smile? Can you smile?
1 month after his second cornea transplant, Travis returns to have his stitches removed.
Oh, he is a happy baby now. He's happy, he's smiling, he's laughing, looking around. I don't know how much he can see, but I think he can see a lot. But I guess we'll find out.
The OR team is ready for Travis.
Love you. You're a big good boy.
My turn.
Do we have a choice?
Oh,
Now
Now
we're
listen,
gonna cry.
she's a very nice lady. She's gonna keep care of you. I'll see you when you get out. Now, don't you cause them grief in there.
Of course not.
Okay? Love you, baby.
Hey, it's okay. Just a grandma. I'm just a grandma. There we go.
Wearing a funny blue hat.
See you later.
Thank you.
I'll sign for it later.
Oh, thank you very much.
All bundled up.
So this suture's loosened already. You can see how quickly they heal. And in adults, you wouldn't be able to do this for a year. And yet in the kids, we can take out their stitches at 1 month. And if you don't get them out early, then what happens is that they cause irritation. And blood vessels grow into the new cornea, and that leads to a much higher chance that the cornea will reject. Okay, all right, I think everything looks great.
Good.
Excellent. I'm very pleased with the way both eyes look.
Good.
So I think that the chance for reasonably good vision is excellent.
Perfect.
Good.
Amazing.
So he'll probably still need glasses.
He's for sure going to need glasses.
As long as he can see, that's all that matters.
Right. And I mean, I think he'll see reasonably well.
Good.
And that's what I think that fits in with what you've been reporting, that he sees stuff,
Yeah, I think he
especially
is.
up close.
Yeah.
But for very fine details and for proper development of vision, we'll want him to wear glasses.
Sure, no problem.
Right.
That's good.
Okay.
Great.
Thank you.
Thank you.
Very much.
Pleasure. Okay,
you.
see you again in a couple
Nice
weeks.
to see you.
Nice to see you too. Okay.
Doesn't get much better than that.
It's been 10 days since Renee's surgery.
How are you doing, Renee? Yeah? Did you eat any more today?
No.
No? So she needs a little time to get hungry.
Yep.
Okay, but she's going home.
That sounds good.
Yeah, and you're just gonna slowly, I guess, increase the amount that she takes by mouth.
Yes.
And I'll see her again, I guess, in about a month or so. Yeah. And if there's any problems before that, just let me know.
Okay.
All right? So, goodbye.
Bye.
See you later, alligator.
Yeah.
After a while, crocodile.
Bye-bye. Thanks very much.
Yeah,
Bye-bye.
you're very welcome.
Bye-bye.
Take care.
You're going home?
Yeah.
Yes. Are we happy?
Yeah.
That is great news. The hospitality here have been great. It's good to go home. She's eating a little, drinking a little. Once she gets home, I'm certain she'll pick up on that. She'll do better. Right?
Renee will return in 6 weeks for a checkup to ensure the reflux problem does not return as she begins to eat more at home. One month after his appendectomy, Harrison returns for his follow-up appointment.
Remember what you look like?
Yeah.
So how you been since I saw you last?
Good.
You had any problems? Let me have a little feel. Have you had any problems eating anything?
Ow.
Right there. Mine, please. It looks good. Good. All right. Do you have any questions?
Nope.
Okay.
Thank you.
Thanks. See you later. Bye-bye.
He's feeling much better now. He's beating up his sister.
As the weeks go by, Harrison becomes stronger and stronger.
It's been a month, I believe, hasn't it?
Just over a month. And he's 100% back to normal, as you can see.
Undergoing emergency surgery is a frightening prospect, but Harrison has managed to come through it with flying colors.
Cool.
6 weeks after surgery, Renee returns for her checkup.
Are you gonna be happy to see that online?
Yeah.
Sure.
Yeah. Yeah.
Not too bad.
Good to see you. Hi, Renee. How are you?
Yeah.
Nice hat.
Thank you.
Thank you.
It's purple.
Yeah.
You like that color, huh?
Yeah.
Good. How's she doing?
A lot better.
Okay. And how's she doing with eating?
Some days when she goes to school, she eats well.
Yeah.
If she's at home, you can get her in a cycle and you can get her to eat. But once she goes to school, I'm finding that she's not eating as well as she used to be.
Well, sometimes it takes a lot of time, and it may still be a little bit tight where we did the fundoplication. And the eating thing will come with time.
Okay.
Are you feeling better, Renee?
Yeah.
That's great. Alrighty. Take care now.
Goodbye.
Bye.
Bye, Renee. Good to see you.
Okay, thanks.
See you later. Bye-bye.
Yeah.
After a while, crocodile.
Now that Renee has had her surgery, she continues to grow stronger and gain weight.
Sure.
She is no longer struggling with reflux and can put one more problem caused by cerebral palsy behind her.
How are you?
Good.
Hi, Travis. How are you today?
Hi, sweetie. You ready for your new glasses? Take a look here.
We're not.
You're gonna leave it like that for a minute.
2 months after his corneal transplants, Travis gets his first set of eyeglasses.
Leave it on him right now just so he can get accustomed to it and not hold on.
But I know it's just a focus.
And his first chance to experience nearly normal vision.
Are you happy now? Are you happy now? Hi. What are you doing? What are you doing? What are you doing? Oh, 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 oh.